not letting we're not letting clients in, just the dogs or the cats.
All right, it looks like we're live. This is exciting. So let's give everybody some time to join. Let's see. I'm actually pretty excited about this topic myself. You know, it's we here in Canada, at least, we recently legalized the use of marijuana, but there's a lot of still unknowns.
Yes.
You know, not just in pets, but also in people. So it's very interesting, and there's a lot of misinformation and things. So yeah. I'm excited to kind of hear your thoughts on it.
Yeah, I think there's also a lot of questions in the veterinary community, both from a medical perspective, but also from a regulatory perspective about what we can say, what we can do.
Exactly. And it's hard because even like I think about COVID right now, and the rules are very different depending on where you live.
Yeah, exactly.
So this is another one of those things where it's going to really depend on where you live, I think.
I agree.
So we'll give a couple more minutes for everyone to join, and then we can get started.
Terrific.
Who do you have in the back there?
I have Cozy. Let me see if we can. Cozy. There she is.
Hi.
She's got a real good sad. She's got a real good sad dog face.
Oh. Very cute.
Yes, I know. I'm sorry, sweetie.
Oh, that's your puppy?
No, it's our manager's dog.
Oh, okay. Gotcha. Very nice. So how are you balancing all of these things? You're practicing, you're authoring, you're doing these.
I often ask myself the same question. I'm not I'm not always sure. And there are moments when it's sort of like hair on fire, but you know, it's kind of one of those one thing at a time sort of deals. And
well, you've done a lot.
I'm very fortunate to have some very good and very capable people around me trying to keep things in order.
It's very impressive what you've done.
Thank you.
I can only hope as a young veterinarian.
Like I say, one thing at a time.
Yeah. All right, so we'll let everyone trickle in, but I think we can go ahead and get started here.
Okay.
So, you know, again, Dr. Richter, thank you so much for taking the time. We really, really appreciate it. You know, you've been with us now twice, and we love having you. So today's topic is CBD oil for cats. And again, I just want to make this disclaimer for everyone. You know, we're all here to learn and get some information from some of the experts in the industry. So this is not for diagnostic use or for therapeutics. So that's always going to be your veterinarian. But let's all get started and learn about CBD oil in cats. So I'll give a little intro to Dr. Richter. He is a very impressive veterinarian, America's favorite veterinarian, and the international best-selling author of The Ultimate Pet Guide. So check that out if you haven't already. But Dr. Richter, I'm going to let you kind of introduce yourself and get started.
Okay, well, thank you. So just by way of a real quick background, I have been a veterinarian in the San Francisco Bay Area for a little over 20 years. And probably over the past 15 years or so, I've been, you know, kind of moving more and more towards what I would describe as integrative medicine, meaning both Western medicine and alternative and holistic options as well, and really just kind of weaving all of that together to achieve a better outcome. So, you know, it was really kind of a natural progression for me to start to look at cannabis as it became available as a medicine, both for people and for animals. And I've spent the better part of the past 5 years or so really researching cannabis and what it can do, and speaking with veterinarians and with pet owners, also speaking with lawmakers, as as we discussed earlier, just trying to get the legislative language correct, so veterinarians have the space to have the conversations with pet owners that they need to. So it's been an interesting path, but I am thrilled to be here.
That's awesome. So you mentioned integrated.
Yes.
And can you help us understand how is that different from what we get at the veterinarian now? There's lots of different words like that, right? The holistic veterinarian, conventional. So why are there differences, and why do you identify yourself with integrative?
So there's various sort of schools of medicine, if you will, and I think the one that most of us are familiar with are what we might call conventional medicine or Western medicine. So so things like pharmaceuticals, surgery, radiation therapy for cancer patients, these sorts of things. And I am very much a big fan of conventional Western medicine.
Exactly.
I think most of us probably wouldn't be alive today without the benefit of Western medicine in some fashion or another. But the reality is that Western medicine does not fix everything. And one of the things that Western medicine has a real hard time with are chronic diseases and diseases that are hard to put your finger on from a diagnosis standpoint. For all those people out there, or for all those animals out there that have symptoms and they go to the doctor and nobody can ever quite give them an exact answer as to what's wrong with them. Those people know where sort of Western medicine falls short. And
they've tried everything.
Exactly. I mean, Western medicine needs a target.
Right.
And if it doesn't have one, it has a real problem.
Right.
So then when we look at that, sort of the other side of the coin, what could be termed holistic medicine, natural medicine, complementary and alternative therapies, there's a lot of names for the same thing. But what we're looking at in that regards would be things like herbal therapy, nutritional therapy, acupuncture, chiropractic, any number of things. And it's interesting because when you look at these kinds of therapies, the sort of the common thread amongst all of them is they're really designed to help the body heal and be healthy as a whole unit, hence the term holistic. And the really advantageous thing about that is, unlike Western medicine, holistic medicine does not necessarily need that target in order to be effective. And with complementary care or holistic care, we're often able to improve conditions that Western medicine has sort of failed with. So chronic pain, chronic gastrointestinal issues, quality of life issues for older pets or animals that have cancer, these sorts of things. I mean, these are the kinds of places where Western medicine has real problems, but that's also where alternative therapy really shines. So this is a very sort of long-winded answer to your question, but because there is enormous value in both sides of that coin, to me, the magic in all of this is in the integration of both Western medicine and alternative therapy. Thus, what I would term and what other people term as integrative medicine.
I love that. That's a really good way to think about it. I think we don't have to be in one or the other. It can be what works and what helps.
Very few things in life are black and white.
Right. Right. Oh, okay. So the big topic today is, CBD. But again, there's a lot of names for the same thing here too. So there's cannabis, there's the hemp plant, there's CBD, THC. So can you make sense of this for us? What are we actually talking about?
Sure.
With
Yeah.
pets?
I think that's a great question, and I think it's exactly the right question to start with, just so everybody understands exactly what we're talking about. So cannabis, or more accurately, Cannabis sativa L is the species of plant that all cannabis medicines as well as recreational cannabis arises from. So it is a species of plant. I think everybody's probably seen a picture of cannabis at some point. And that plant has the ability to produce an enormous variety of chemical compounds. Many of these chemical compounds are what are termed cannabinoids because they interact with a neurotransmission system in our bodies called the endocannabinoid system. So these cannabinoids that cannabis produces can interact with those neurotransmitters, and therefore they have biological activity. There are other compounds in cannabis as well. Probably the other big category are what are called terpenes. These are the essential oils in cannabis, which also can have a lot of medicinal properties to them as well. So the thing about cannabis is not all cannabis plants are the same, even though they're the same species. Depending on their specific genetics, some of them are going to produce more of some of these compounds and less of others. So for example, when we're talking about what is termed hemp, so the hemp cannabis plant produces a lot of CBD and a lot of potentially other cannabinoids, but very little, if any, THC, because THC, as you know, is the psychoactive compound in cannabis, and it's also the thing that's illegal. But to be clear, that hemp plant that produces no THC is the same species as that marijuana plant that produces a lot of THC. It's just a different strain. And the important thing for people to realize is we seem to have gotten to a point where people sometimes will use the term CBD as kind of a blanket term for cannabis in general.
Right.
And that is very much not the case. So, saying CBD is cannabis is probably a little bit like saying that a tire is a car. It's a piece of the whole. And the reason why that's important is because, CBD is great as a medicine, but as I was saying, there's so much else that goes into cannabis. And it's really much like the conversation we just had about integrative medicine. It's really sort of the entourage effect or the combination of all of these compounds that naturally occur in cannabis that really allow it to have the medical application that it does. So it's really important for people to realize that, if they're giving their pet or taking themselves a cannabis product, that they know what's in it. Because like I say, CBD at most is one ingredient of many.
Right. So, up until recently, like we would consider this as a toxin as veterinarians.
Right.
And we have these receptors, cats and dogs have these receptors. So what makes something toxic and what makes something medicinal?
Well, usually the difference, in many cases, the difference between toxic and medicinal is dose. Clearly there are substances out there that are just blanketly toxic and would never be used as medicine. But, if I pull any pharmaceutical off the shelf in my office, given inappropriately, it could be toxic. And that's just the reality of medication. As I often will tell people, if you're going to say that any given compound, whether it's pharmaceutical or natural, if you're going to say that it has medicinal activity, that probably also means that if used improperly, it could cause problems. They're two sides of the same coin. You can't generally have one without the other. Although interestingly, CBD happens to be one of these compounds that it's almost functionally impossible to cause CBD toxicity. The molecule is so safe that there really is sort of no known published toxic dose.
Okay, that's very interesting. So can you then tell us what is the most up-to-date status for the use of CBD products with pets?
So, we've been fortunate in the past, 3-4 years that we're now starting to see the research come out. Prior to that, it was a lot of speculation based on based on what we knew in human medicine and laboratory studies, etc. But we had nothing to go on specifically for pets. We now have a number of studies that have been published specifically in animals, studies that have shown that CBD products are effective in treating pain associated with arthritis in dogs. Studies that have also been shown that CBD products can be effective at treating seizures in dogs.
Wow.
There have been, there are more studies in dogs at this point than there are in cats. But we do know from the studies that CBD is safe in cats and can also be beneficial from a pain control perspective.
That's amazing. Because for a long time we couldn't really talk about it with clients, and that would, get us in trouble. So would you say, as a general rule of thumb, that cats and dogs are not the same? And what should you do if you want to use some of these products with your cats?
That's a great question, and clearly cats and dogs are not the same. I don't know if this is a thing they teach in all vet schools, but I used to have an internal medicine professor that was very fond of saying that cats are not small dogs.
Yes.
When it comes to treatment, I imagine that's something that everybody hears in vet school, because they very much do. They do react differently to things. Cats physiologically have some significant differences from dogs, particularly in how their livers work. So it is important to sort of think of them differently. Like I said, CBD in both cats and dogs does have a tendency to be very, very safe. So that's a big plus. And I have seen cats do very well on cannabis products that contain CBD as well as other things. So yeah, it can absolutely be beneficial, but it is important that we're dosing to the individual, not animal in general, or even cat specifically. We're dosing to the individual based on their medical condition, their body weight, their age, and just any number of other factors that might impact how the kitty's going to do.
So just for our audience, do you want to tell us, what we should do if we want to use this product, sort of step by step, and what you think it would be a good use versus not so good?
Sure. So, I mean, I think that from an application standpoint, good things to look at from to treat kitties with like a CBD type product. As I mentioned before, pain. So if you have a kitty that is a little older and maybe arthritic, sometimes anxiety, it seems to be helpful for as well. So if you have a cat that tends towards anxious or is stressed for some reason, sometimes there can be a benefit there as well. More broadly speaking, when people are going to make that decision that they are interested in trying cannabis for their kitty, and this holds true for non-cannabis as well, for any natural supplement at all, step one is always going to be have a conversation with your veterinarian.
Right.
There's never a benefit in keeping a secret from your veterinarian as far as what you're doing. And it very much depends on where you live and who your veterinarian is, on how comfortable they are going to be to have a conversation with you about cannabis. That said, if you're lucky and your veterinarian is knowledgeable and is willing to chat with you about it, it can be very, very beneficial. If that's not the case, then options at that point would be, you can see if there's a veterinarian in the area that might be beneficial. If not, there are resources out there that you can use to give you some guidance as well. You mentioned a little while ago my book, The Ultimate Pet Health Guide. It's an entire chapter in there dedicated to cannabis for animals, including information as far as dosing and dosing calculation and that sort of thing. So that's a good reference for people to look at. The other thing, getting back to what we were speaking of before, in so much as that CBD is not synonymous with cannabis, is that it's very important for people to understand what they're buying. if you buy a product that says CBD on it, but it turns out it has a significant amount of THC in it, you may inadvertently get your cat really high, which is not a good thing. You know, I mean, as I always tell people in my office, having your dog or your cat stoned is never an acceptable side effect of treatment. It's just a non-starter. You know, it should never happen. And in order to do that, again, it comes back to choosing the right product and understanding dosing.
I mean, I hear you, but how do you know that, you know, that your cat has an overdose or that's an intoxication? How do you tell? What are the signs?
Well, I mean, you know, from a cat perspective, I mean, what you're probably likely to see is them being sort of not completely with it cognitively. They may seem kind of spaced out, more spaced out than normal. I know cats are sort of spacey on their best day. They may be having some problems with balance. They may seem a little wobbly on their feet. You don't often see vomiting, but it is possible that you can sometimes see vomiting as well. So those are really the kind of things that you're looking for.
So your advice would be to contact your veterinarian at that point.
Yeah, if there's ever any doubt, definitely contact your veterinarian, and realize that, you know, a good way to make sure that you're buying a product that does not have much, if any, THC in it is if you're buying a product that is sold over the counter. So pet store, health food store, whatever it may be, that product should not have much, if any, THC in it. The only products that you're gonna get that have significant THC in them is if you live in a place that has medical or recreational cannabis and you went to a dispensary, then those products very well may have THC in them, and those you need to be much more cautious with from a dosing standpoint than, say, something that you've purchased in the pet store.
So we actually have a great audience question that kind of ties into what we're talking about, and that's what information to be included, or you know, how do you know when you're trying to buy something? I know we don't want to promote specific products, but I think this is a great question.
Yeah, I agree. So as I said before, you know, cannabis is a lot of things from the standpoint of the potential compounds that can be in it. And on top of that, as with any agricultural product, there's always the concern of contaminants of some kind, pesticides, fungicides, bacteria, fungus, what have you. So any cannabis product that you buy, you should be able to obtain what is called a certificate of analysis, or sometimes that's referred to as a COA. And effectively what that is that is a laboratory analysis of the product in question. And it will lay out what cannabinoids are in there, how much CBD, THC, other cannabinoids. Frequently, it will also list the terpenes that are present. These are the essential oils that I was mentioning can be beneficial as well. And a good COA is also going to test for these various contaminants. So what you're looking for is no detectable levels of things like heavy metals or pesticides or fungal contamination or anything to that effect. Because needless to say, if you're given this product as medicine, you don't want to be also administering pesticides to your pet. Yeah. The one thing that it's real important for people to remember about a certificate of analysis is a COA is only good for the particular batch of medicine that it was made for. And what I mean by that is, you know, the thing about agricultural products is every time those plants are grown and the medicine is extracted, it's a little different than the last one. It's never going to be exactly the same. It's nature. It's Mother Nature. I mean, there's no, you know, there's no real consistency in that sense. So a certificate of analysis done on a product that was harvested last year is going to be different than one that was harvested this year. So it's important that the COA you're looking at is specific to the batch or the lot number of the thing that you actually have in hand.
That makes sense. And, you know, I think of corn, and when we're harvesting corn and you got mold one year, you know, so it's like with anything.
Yeah.
So another question that we have here, what are some specific feline health conditions that CBD might be good for? And I
Yeah.
know we talked a little bit about this.
Yeah, we did. And, you know, I think the big ones to really look at right off the bat would be pain, arthritis, that sort of thing. Again, anxiety, particularly CBD, can be beneficial for anxiety. Another thing that I've seen a lot of benefit in dogs and cats with cannabis is chronic gastrointestinal issues. So
Okay.
not like my pet ate something gross and now they have a tummy upset. More of, you know, my cat or my dog has inflammatory bowel disease and they haven't had a normal bowel movement in 6 months. Something like that, because it turns out that there's a lot of endocannabinoid receptors in the gastrointestinal tract, and by using cannabis, we can actually significantly decrease the amount of inflammation in the GI tract and encourage some recovery of the normal GI flora.
That's so cool because, you know, you're talking about anxiety, inflammation, pain pathways. So these are very different issues that this one product, one chemical can address. So do you want to kind of talk us through a little bit of how that works in your body?
Sure. Yeah. You know, I mean, and I think there's two ways to look at that. Both of them, I think, are quite fascinating. The first one is the endocannabinoid system, which I mentioned a little bit earlier, is this system of neurotransmitters that really is present throughout the body. It's in the brain, it's in the spinal cord, it's throughout most of the tissues in the body. So literally, pretty much any tissue or any organ that you can think of has endocannabinoid receptors associated with it, which is why cannabis has the potential to affect so many different body systems.
Very cool.
Other thing to consider is sort of the interconnectivity of the body itself. So as a real good example, there's this thing called the gut-brain axis. And there is a very direct connection, neurologically speaking, between our brains and our gastrointestinal tract. And GI tract health is very commonly linked to brain health and vice versa. So for example, I think we all have experienced at periods of high anxiety, we often get gastrointestinal upset. You get a stomachache. That's the gut-brain axis at work, but it works the other way as well. You know, if you can calm the brain down or calm the gut down, it works on the other system. So everything's really interconnected here.
That's very cool. We had a question from Elaine here. So she was using CBD for IBD, and it sounds like it didn't seem to help much. So she's wondering if she did anything wrong, and following the dosing on the bottle. Do you have any advice for her?
Well, I mean, it's hard to say because there are so many potential permutations here about what could have gone right or could have gone wrong. It could be that it's a function of dosing. I will say that many cannabis products on the market, the dosage that they recommend on the bottle is probably too low.
Okay.
And part of that is just a function of the research is still coming out. Part of that is a function of the, CBD as a molecule is fairly expensive.
Okay.
And if these companies were recommending the dosages that are coming out in the research, the product would very likely become unaffordable to a lot of people. So I think the companies are hesitant to put those higher dosages on there for fear that people won't buy the product. So that's one aspect of it. But the other thing that I think is really worth bringing up here, and this is a very good example of this, is that the efficacy of cannabis as a medicine very frequently has to do with the full spectrum of ingredients in the product, and specifically in this case, I'm thinking of other cannabinoids. So, for example, there's some evidence out there to suggest that that the real sort of magic, if you will, from a GI health perspective with cannabis may involve THC, at least as a partial player. So a lot of times with these gastrointestinal issues, you wind up having to use a product that has a certain amount of THC in it. The relative ratio between the two can vary, And to be clear, it is absolutely possible to give a dog or a cat a medicinally active dose of cannabis that has THC in it without them getting high. But again, this all comes back to appropriate dosing. So knowing exactly what product you have, making sure that the COA tells you exactly what's in it, and also being able to do the math to figure out exactly what you're giving. And this is really where consulting with your veterinarian is going to come in very, very handy, because as you know, from a dosing calculation perspective, if you screw up and move a decimal point one way or the other, you are either overdosing or underdosing your animal by a factor of 10, which can be really bad. So, dosing calculation, it matters.
And you will do this with your clients?
Absolutely.
Yes. Yeah.
Yes.
Can you just talk a little bit about the different formulations? I know today we're talking about specifically CBD oil, but there's gummies, there's all kinds of different formulations that you can get them. What's good, what's bad, what's ugly in your opinion?
Okay, so from the standpoint of products that are going to be administered to animals, my recommendation for people, unless you're under the direct guidance of a veterinarian, stick with products that are specifically made for animals. It's not to say that you can't use products that are made for humans, but again, the dosing issues have to be addressed very, very carefully. So if you stick with products made for animals, mostly what you're looking at is either something that's going to be a liquid or like a treat of some kind. My personal preference are the liquids, because I feel like that gives you a lot more flexibility from a dosing perspective. You can give 25% more or 25% less or whatever it may be. With treats, it's a little bit tougher to do, because if you break a treat in half, you don't really know for certain whether or not those two halves contain the same amount of medicine.
Exactly.
It's sort of an unknown. And I think the last thing to say in that regards, and this kind of goes along with just get things made for animals, but obviously there are edible products out there made for people. And I would very, very strongly steer people away from those products for a couple of reasons. Number one, edible products for people tend to be very, very strong. And it's going to be real hard to dose them in any accurate or effective way. Number two, some of these products that are made for people might have things in them that are actually toxic to pets. So things like chocolate or raisins can be highly toxic to animals. And if you decide you're going to give your dog or your cat a piece of that oatmeal raisin cookie with cannabis in it that you have, that could be really problematic.
You have a different problem. Yeah.
A very different problem.
So thinking about cats specifically, they're a lot more sensitive, in their sense of smell. Do you have any issues with maybe the terpenes or anything when you're using CBD oil?
Well, certainly as it pertains to cats. Cats are tricky from the standpoint of getting anything into them. Medicating a cat is difficult on their best day. But yeah, they don't always appreciate the taste.
Sure.
Generally speaking, from a taste and a smell perspective, it's the terpenes, it's the essential oils. The cannabinoids like CBD and THC are actually odorless and tasteless.
Okay.
Cool. But that said, like I said, if you can get away with giving a liquid product directly orally, that's great. Alternatively, you can try and mix it in with some food and see if they'll eat it that way. Oftentimes what I will suggest, and this is true for anything you're trying to medicate a cat with, is, mix it in with something that's really strong smelling. So like canned tuna, canned salmon, something like that. Something that's going to overpower the smell and the taste of whatever the medicine may be.
Gotcha. So we have a couple of questions, and I know we talked a little bit about chronic diseases and how CBD oil can help. Yeah. But some of the specific examples here, we have leukemia, kidney disease. Can you speak specifically to some of those conditions and how it may or may not
Sure. I mean,
How?
I'll tell you what we know, because nobody has the definitive answer on these questions. But what we
Yeah.
know is that there is all kinds of research out there, to show that various cannabinoids, including CBD, have anti-cancer properties through multiple different biological pathways.
Hmm.
So there's no doubt that there's anti-cancer properties there. Um, that said, I would never personally suggest that somebody use a cannabis product as a sole treatment for cancer, leukemia,
Hmm.
or otherwise. My experience as a veterinarian is, if you're going to try and get the best outcome with a cancer diagnosis, it's something that you really have to approach from as many different angles as possible. So, that could mean cannabis. It could mean other natural therapies. It very well could also mean chemotherapy. Um,
Hmm.
and I know that's not necessarily always what people want to hear. But if you're trying to get ahead of cancer, you really have to attack it from every conceivable side that you can.
Right. It's a
And
battle. Yeah.
obviously keeping an eye towards side effects and quality of life issues and whatnot. But as
Mhm.
long as the kitty's feeling fine, when it comes to cancer, excuse me, you really want to kick it when it's down. So you do everything you can to eliminate as much as possible.
Very good. And I think we should mention, if your cat is on any other medications, and if you're wondering about using CBD oil, what should you be thinking about?
Again, I think this is it's a good question to consult with your veterinarian about. But speaking in
Hmm.
generalities, I think the biggest issue that we think about with CBD is metabolized by a fairly specific enzyme pathway in the liver. So why that matters is a lot of other drugs are metabolized by the same enzyme pathway in the liver. So if you're giving CBD and you're giving another drug and they're both metabolized by the same enzyme, sometimes what you can happen is you can have altered metabolism of one or both of the medications. And depending on the nature of the medication, it could mean that the medication is less effective with CBD being given,
Right.
or it could potentially mean that the medication stays in the system longer because it's not being broken down, and there's a chance of toxicity.
Right.
So
And we
it
don't
can
want that.
literally go either way. So again, this is where things get a little complicated, and having some medical guidance is a really good idea.
So would you say, as a rule of thumb, if your cat is on any other medication and you're thinking about using CBD, you should always talk to your vet?
Yes. As I said before, I think if you're thinking about using CBD with or without other medications, you should always talk to your vet.
Excellent. All right. So again, your book is amazing. So I want to make sure that I get a copy, and make sure I go through that chapter. So I'm just looking at some of the other questions. So here's a good one. I'm looking at transdermal applications. So if they don't like the taste of it, how else can you give it to cats?
You know what? There was a study done, I think it was just dogs, where they looked at various formulations of cannabis, different types of oral preparations, but they also looked at a transdermal. And what they found with the transdermals was it took a lot longer for them
Sure.
to achieve blood levels that they otherwise got from giving it orally, but they did ultimately actually achieve blood levels. So I think there is a
Okay.
potential application for transdermals. I don't believe, or I'm not aware of that research in cats just yet.
Hmm.
But as I'm sure many of the people listening are aware, transdermal medications are a thing, for cats. They're not they're not generally my first choice of medications, only because the absorption is so spotty from one individual to the next. I think
Yeah.
it's very hard to know exactly how much of that medication is actually getting into the kitty. But if there's no other option, then transdermal can be a very good one.
And yeah, if we did have a good way of monitoring, I think that could be very cool, especially in
Yeah,
cats with their metabolism.
agreed.
Um, so one last question for you. We talked about some of the benefits, we talked about some of the risks. Um, are there any pet-specific products that a veterinarian can recommend today?
Well,
that's a loaded question.
That's a loaded question. So let's see. First thing is, it very much depends on where the veterinarian is practicing. Yeah. So for example, here in California, the answer to your question is no. Mm-hmm. There is no cannabis product that I am legally allowed to recommend.
And same where I live as well.
Yeah. So there are other locations where things are a little bit more flexible. Colorado, I believe Oregon is mm-hmm. a bit more flexible as well. So again, I mean, it's variable as far as what we as veterinarians are both allowed to discuss, allowed to recommend, allowed to sell in the veterinary practice. Again, in California, that's not something, even like a hemp-based CBD product, we're not allowed to have in the office, which is funny because somebody can go across the street to the pet store or the gas station and buy CBD, but they can't buy it from their pet's doctor, which is just a whole nother layer of insanity. But the reality is a lot of veterinarians' hands are tied in that regards.
Mm-hmm, mm-hmm. So, you know, I think as we go on, even at Basepaws, we're definitely interested and excited about what the genetics has to say about CBD and how cats can make use of this. So I'm sure we'll learn more all together. But Dr. Richter, I just want to say thank you again so much for taking the time, helping us figure out all of these nuances. And here we have your website. So if you want to learn more about Dr. Richter, you can learn more at drgaryrichter.com. And don't forget his amazing book as well. So I think we're going to wrap it up here today, Dr. Richter. Thanks again so much, and stay safe.
Thank you. You as well.
All right. Take care.
Bye-bye.